The heart is a muscle that works like a pump. The main job of your heart is to pump blood throughout your body. The heart has a right side and a left side. Each side has an upper chamber, or atrium, which collects blood returning to the heart, and a muscular lower chamber, or ventricle, which pumps the blood away from the heart. The pumping of your heart is controlled by an electric current, or impulse. The impulse starts at the sinoatrial, or SA node, then it spreads through both atria and causes them to contract, squeezing blood into the ventricles. The impulse then travels down to the atrioventricular, or AV node. The AV node splits into two branches and travels to the bottom of your ventricles at the same time. This lets your heart pump effectively. An arrhythmia is when your heart does not beat in a normal rhythm. Tachyarrhythmia occurs when the heart beats too fast. There are two types, which are often referred to as ventricular tachycardia, or VT, and ventricular fibrillation, or VF. These are the most common fast heartbeats that these devices treat. Bradyarrhythmias occur when the heart beats too slowly. Arrhythmias are a very common problem and do not usually cause any issues. In rare cases, they can cause you to become dizzy or very tired. An implantable cardioverter defibrillator, or ICD, is a device that's placed under the skin, below your collarbone, and is designed to detect harmful heart rhythms. When an ICD detects an abnormal, rapid heart rhythm, it can do one of the following things. The ICD takes over pacing your heart for a short time, called anti-tachycardia pacing, or ATP, or the ICD gives you a shock to correct the rhythm, called defibrillation. An ICD can also detect if your heart is beating too slowly and will act like a pacemaker by sending electrical signals to the heart muscle to help your heart beat at a more normal rate. There are two reasons why people need ICDs. You either had a harmful abnormal heart rhythm or you are at risk for having one. You should refer to your device as an ICD and not a pacemaker. While all defibrillators are able to pace your heart, the two devices are very different and need to be treated differently. A CRTD, or cardiac resynchronization therapy defibrillator, is an ICD designed for people with heart failure. It causes both sides of the heart to beat more effectively. A CRTD has an extra lead that goes into the left side of the heart. A CRTD is able to both pace and shock your heart, just like an ICD. The ICD, or CRTD, has two basic parts: the generator, sometimes called the battery, and one or more wires, called leads. The generator contains the battery, wiring, and a computer that make the ICD or CRTD work properly. The generator can be programmed to detect harmful heart rhythms. The leads are special wires that connect one end of the generator, and the other end is attached to a spot in your heart. In general, ICDs and CRTDs are implanted on the left side of the chest, just below the collarbone. When the generator senses abnormal heart rhythms, it sends out either pacing pulses or an electric shock to the heart through the leads. Your device does not prevent the abnormal rhythm from happening, but it tries to correct the abnormal rhythm as it happens. Your device will store information about your heart's electrical activity, which is checked when you visit the pacemaker defibrillator clinic. When the ICD or CRTD senses an abnormally fast heart rhythm, the device tries to pace the heart at a faster rate than the heart is going on its own. Doing this can stop the abnormal heart rhythm and allow your SA node to act as the pacemaker of the heart. You usually do not feel anything when this happens. For abnormal heart rhythms that are extremely fast, or if ATP does not work, the ICD or CRTD will give a shock to the heart. This works just like if pads were put on your chest and a shock is given by medical personnel. Your device uses a smaller amount of energy because it is attached right to the heart muscle. Some patients describe the feeling as a small thump in the chest, while others have a strong, uncomfortable feeling like being kicked in the chest. Anyone touching you when you get a shock may feel a slight tingling sensation, but will not get a shock or be harmed in any way. If your heart beats too slowly, the ICD or CRTD can act like a pacemaker and stimulate your heart to beat at a healthy rate. Most people will not feel anything when this happens. The day of your ICD or CRTD implant, plan to arrive at the hospital using the instructions you received. You do not have to arrive early, as the time we have given you takes into account the time we need to get you ready. You will check in to the patient registration desk on the second floor of Y2 Bergen Center. This is the same desk as the pacemaker defibrillator clinic. Take the elevators from the south entrance up to the second floor and turn right through a doorway. After you check in, you will go to the pre- and post-procedure area and stay there until you are ready to go in for your ICD or CRTD implant. Once you are in the pre- and post-procedure area, you will change into a hospital gown and your chest will be clipped and scrubbed with a cold cleaning solution. You will have a chance to use a toilet. An intravenous or IV will be placed in your arm. You will get an antibiotic to prevent infections, and this IV will be used during the implant to give you medications to keep you comfortable. The implant will occur in a special room called the procedure lab. The doctor who will put in your device will come and meet you in the pre- and post-procedure area. This is a good time to ask any final questions before you read and sign the consent form for the ICD or CRTD. In the procedure lab, the doctor, nurses, and X-ray technologists are some of the team members needed to put in your device. All staff will be wearing gowns, masks, hats, and lead aprons. Your chest will be washed again with a cold cleaning solution and sterile sheets will be placed over you. It is important that you do not touch the top of the sheets once they are in place. Tell the nurse if you have any questions or concerns during the implant and the nurse will be able to assist you. You will receive medications through your IV to help you relax, and you may even sleep lightly. You will also receive pain medications through your IV as needed. Freezing will be given to numb the area below your collarbone where the generator will be put in. This may sting or burn for a short time. Once the freezing has taken effect, the doctor will make a small cut. The ICD or CRTD leads will be threaded through veins to the heart, guided by a special X-ray. This is not painful, but you may feel some pressure as the veins are entered. The generator is then placed just under the skin. Tell the nurse if you have any pain or concerns. It is important that you stay very still during the implant. Once the device is in, the cut will be stitched close. These stitches do not need to be removed as they will dissolve on their own. Steri strips and a small dressing will be placed over top, and an even larger dressing may be put on top of that. The whole procedure takes 2 to 4 hours to complete. Yours may take longer or shorter time. After your implant, you will be taken back to the pre- and post-procedure area on a stretcher. You will be hooked up to a heart monitor that will show your heart rate and blood pressure. You will have a chest X-ray to check your ICD or CRTD placement. You will also have an electrocardiogram or ECG done. A nurse from the pacemaker defibrillator clinic will come and check on you to see how your device is working. They will do this by placing a wand on your chest. It does not hurt when your device is checked. You may feel some pain at the site where your ICD or CRTD was put in. If you feel pain, tell your nurse, and your position can be changed or you can be given pain medication to make you more comfortable. You may experience bruising or color changes in your skin around the implant site. If you were on a blood thinner before the procedure, this may be more noticeable. If there is a large dressing or a pressure dressing, it is to be removed after 2 days or 48 hours. Leave the smaller bandage on for 5 days and keep it dry. You cannot shower with the outer bandage on, but you can take a bath if you make sure the bandage stays dry. You may shower when the outer bandage comes off, but do not soak your implant site underwater until after your first checkup. Do not rub soap across the insertion site for 10 days. Do not use lotions or creams on the implant site. The steri strips that cover the implant site can be left on until they fall off. This can take 2 to 4 weeks. The stitches under the skin will dissolve on their own. When to call the pacemaker defibrillator clinic. If your wound swells, bulges, drains fluid, turns red, or feels hot to touch. If you have any swelling or pain in the arm or hand on the side of your device. If you have a fever and one of the symptoms above. Or call if you have any concerns about your device. If you feel very dizzy or faint, have someone take you to your nearest emergency room or local healthcare facility. Do not raise your elbow above your shoulder on the same side the ICD or CRTD was put in for 4 weeks. Do not lift anything more than 5 pounds or pull heavy objects with this arm for 4 weeks. Avoid arm movements like vacuuming or shoveling for 4 weeks. You can slowly increase your activity to the level you were at before your implant, but avoid swimming, golfing, tennis, and contact sports for 4 to 6 weeks. Your device should not deliver therapy for the natural increase in heart rate with physical or sexual activity, but occasionally this does occur. Sexual activity can be resumed when you are comfortable and can walk up 2 flights of stairs. Your doctor will discuss with you how long you have to wait to drive. This depends on the type of device you had put in and why you needed the device. Most people have to wait 1 month to drive again, but some people have to wait longer, up to 6 months. Manitoba Public Insurance has rules for your doctor to follow about driving after getting an ICD or CRTD. If you receive a shock or therapies, you will have driving restrictions again. Have someone take you to the nearest emergency room or your local healthcare facility if you receive a shock and continue to feel chest pain, palpitations, short of breath, or dizzy. Or if your symptoms get worse, you receive multiple shocks. Do not drive yourself. Ask that any reports or tests be faxed to the pacemaker defibrillator clinic. If you receive a shock and do not continue to feel chest pain, palpitations, short of breath, or dizzy, your symptoms improve, or you only receive 1 shock, call the pacemaker defibrillator clinic the next business day. The pacemaker defibrillator clinic is open Monday to Friday, 8 a.m. to 4 p.m. Because a shock can be sudden and unexpected, it is normal to feel upset or anxious afterwards. Each time you come to the pacemaker defibrillator clinic, you will be seen by a nurse who will test your ICD or CRTD and make sure the settings are the best for you. When it is needed, a cardiologist will be asked to see you about your ICD or CRTD or your heart rhythm. How often you come to clinic will depend on many factors. At the end of each visit, we will tell you when you need to return for your next appointment. Your family doctor and cardiologist will receive updates on your visits as needed. Please bring a current list of medications with you to every appointment. Please adhere to the schedule of appointments as best as you can. Please remember, no reminder phone calls are made prior to appointments. Make sure you write down your appointment dates and times. The ICD Support Group of Manitoba is a group that is there to provide support, education, and the opportunity for ICD patients and their families to speak with others who also have an ICD. The support group has regular meetings in a caring and friendly environment. These volunteers share their personal experiences and have many helpful hints to deal with living with an ICD. There are also regular newsletters provided to the group members. For more information, see the ICD CRTD teaching booklet on how to get in touch with the ICD Support Group of Manitoba. Even though your implant may save your life, some people need time to adjust and to feel normal again. Some people report feeling scared, angry, depressed, or even in denial about their device. These feelings should pass with time. Let us know if you are having any trouble adjusting to having your device. Some things may help you accept your device in a positive way, such as getting as much information as you need about your device. This will help you feel more in control. Understand that any emotions that you are feeling are normal and talking about them is a healthy way to cope. Talk to other people who have an ICD or CRTD. Listening to their experiences will give you ideas as you adjust to the device. The ICD Support Group of Manitoba is the best resource for this. Plan on a gradual return to your normal activities. This will help build your confidence. It is rare, but some medical equipment may affect the function of your device. It is important to tell your doctor, dentist, or any technician that you have an ICD or CRTD well before you have any surgery, medical, or dental procedure. It is very important that you refer to your device as an ICD or CRTD and not as a pacemaker, as defibrillators need to be treated differently during medical and surgical procedures. The medical personnel may wish to contact the pacemaker defibrillator clinic before your procedure to ensure proper functioning during and after your procedure. You should always carry your ICD or CRTD wallet card with you, along with a complete list of medications you are taking. There are some things that you need to avoid with your ICD or CRTD. Magnetic resonance imaging, or MRI. This test uses strong electromagnetic fields that could turn off your device. Some newer ICD or CRTD models are MRI conditional. However, this test should still be avoided. Do not go into a room with an MRI machine. Diathermy. This treatment is often used by physiotherapists, and it has electric currents that could interfere with your device. Electrocautery is used during surgery to stop bleeding. It can be used if your device's shocking function is turned off during surgery. Lithotripsy. This is a procedure where stones, like kidney stones, are removed. Your device may need to be reprogrammed for this procedure. Anti-theft devices. These are found in doorways of some stores. You may walk through them, but do not linger in the doorway. If you are a welder, please refer to the ICD teaching booklet for more information on how to be safe while welding. ICDs or CRTDs can cause painful shocks when one is nearing the end of life. These shocks do not prolong life, but can cause distress to patients and their families. ICDs and CRTDs can be reprogrammed to not deliver shocks, and if there is a change in condition, they can be reprogrammed again to deliver shocks. It is important to talk about end-of-life wishes early with loved ones. When someone with an ICD or CRTD dies, information on the device can still be retrieved. If you are going to be buried, the device can be buried with you. If you are going to be cremated, funeral home staff can safely remove the generator. Families should make sure that the funeral home knows that the ICD or CRTD is there so they can take precautions when removing the generator.